Okay, good morning.
Morning.
We have here Professor Pierre Singer from Tel Aviv at ISICEM 2019 in Belgium, Brussels. Just quickly, Professor Singer, I just wanted to ask you regarding the new guidelines, ESPEN guidelines for 2018. Just give us a very quick or brief. What are the new things that has been added to the new ESPEN guidelines? What are the key highlights? And what do you think are still need to, what are the controversies or what are the gaps that we still need to move forward, moving into the next few years?
Well, thank you. Thank you for this question. The new ESPEN guidelines that have been released in 2018 of new insight in nutrition in report to the many studies that have been published from 2000. And the first point is that any patient that is staying more than 48 hours in an ICU is at risk of malnutrition, and we have to consider nutrition for them. The second point, which is very important, is the fact that we have to evaluate the needs of calories and proteins that the patient is requiring. How to do that? We say in the ESPEN guidelines that we should not use anymore the predictive equations, because they are so much inaccurate. And we encourage the patients to be measured by indirect calorimetry to create a target for calories. This is a very important point in these guidelines. The second point is to know what to do with this measurement. And we suggest that in the first 3 days, because of the huge substrate endogenous production, we should not give too much calories and only reach 70% at day 3 of the measurement, and then continue to progress to 80 to 100% in the next days. The route has to be determined according to the GI function, preferentially using the enteral route, but sometimes, if it's not available, use parenteral nutrition. The second important point is a protein recommendation. This is a difficult issue since there are only few prospective randomized studies giving us a clear message. Therefore, the message of the ESPEN society is to give 1.3 gram per kilo per day. However, it's an expert recommendation. It is not based on solid evidence. And we hope that we will have better evidence to suggest for the next guidelines. Of course, we have also to recommend a certain amount of carbohydrate and fat to these critically ill patients, not forget the minerals, and not miss hypophosphatemia that can endanger the patient. Other patient with vitamin D, taking care of specific diseases, post-trauma, sepsis, dysphagia patient, but read the clinical nutrition ESPEN guidelines. You will know everything about it. Thank you.
Thank you very much, Professor Singer. And this has been a great meeting so far. And I wish you all the best for the rest of the meeting. And hope to see you again next year with, obviously, addition to those guidelines.
Thank you
very much.
Thank you.